Welcome back to the House of Health podcast. I am Dr. Anita Raja. I am one of the GPs that works at the House of Health with a special interest in women's health and longevity. And with me today, I have two very special guests. I have the medical director of House of Health over here, who's a GP with special interest in women's health, Dr. Sidra Hassan.
Thank you for having me.
And Dr. Sovia Arshad, who's our absolute favorite. She is an endocrinologist and a hormone specialist. And as you know, when we talk about longevity, hormones have an extremely important place. So hormone optimization is key, and we take all that valuable advice from Dr. Arshad. Thank you for coming.
Thank you so much, Anita, and good to see you, Sidra.
So at the moment, my first question and the topic we're going to discuss today is going to be around testosterone in men. We have a few patients who are using exogenous testosterone and then having issues with their fertility later on in life. So we're going to talk about that. And my first question to you is, why do men suffer with fertility if they are injecting exogenous testosterone, which means testosterone from outside?
Yeah, very good question. Very simple way of explaining that is that if you order a takeaway, would you still cook?
Never.
So if you're getting testosterone from outside, will your body produce it?
Likely not.
No. And we need our own testosterone to produce sperms. So when we are getting external or exogenous testosterone, our intrinsic production falls. So the sperm count falls. So we need to really warn these patients beforehand, especially in a younger age group, if they want to father a child, then they should be careful not to take it.
And if there is a patient who has been using testosterone without any medical advice, sourcing it from a gym buddy or another friend to look better, to feel better, and now they are suffering with, infertility, what sort of advice do you have for them?
So very interesting, and I see a lot of patients like that and come to my clinic, and I ask them that if you have a boat and it stops working, you're not going to try to fix a tire on that. To say, oh no, because my car works with a tire, this is not working, I'm going to fit tire. If you have symptoms, you need to find the cause for the symptom. If we don't treat the cause, we can't treat the problem. Just by assuming that your tiredness and your symptoms are because of low testosterone and not checking it and not finding why your testosterone is low, you're just assuming that that's testosterone. So those people shouldn't be taking that. And I know that they get it from gym or from friends, but then they need to ask a question to themselves of what do you need the testosterone to do? If you want the testosterone to build your muscles, it might do, but it's not going to make you feel very energetic because your own production will fall. And testosterone also mimics a steroid. So your steroid production can fall as well. So you can end up feeling very tired actually. So no, you should never have testosterone just for the sake of it. There are patients who do not produce testosterone for a number of reasons, from pituitary problem or testicular problem, then they should be given testosterone in a more controlled manner. Those who are already on it and now they want to come off it, you need to stop taking that. You need to stop, give it 3 to 6 months, see for the body to restart.
And you talked about sperm levels and, their sperm not being a good quality, the count going down. What sort of advice would you give someone who has been using testosterone, is trying to come off testosterone now, is wanting to have a family and absolutely cannot because the sperm levels are simply not there?
So the good thing about male infertility is that it's easy to treat, isn't it? Because with IVF, if it's a male infertility, the cause, it's easy to treat because you just need one sperm. So you can always have ICSI, you can have one sperm extraction, and you can do IVF. But if we can't even find one sperm for IVF, or you want a natural conception, then there are two ways of doing that. If they don't want to stop testosterone, then we have to give them precursor hormones like beta-HCG so they can produce their own testosterone, and you increase the levels like that. Or if they don't need it, it was just taken wrongly, then you should stop it. You have to stop and you have to allow body to recover.
Dr. Sidra, you are a medical director at the House of Health. You look after lots of patients who come through, and some of them are bodybuilders who have been using testosterone. At the House of Health, we definitely don't endorse the exogenous use of testosterone, but we do get these patients come in and ask for medical advice. What is your sort of take or the advice that you give these patients when you see them?
So when I see somebody who's a gym goer and who's been on testosterone and they come to see me for any health problems, I think I take it back to the reasons why they started testosterone in the first place. Whether they wanted to do it to look a certain way, or whether they were having some sexual dysfunction problem and they tried to self-treat it this way, or are there any other reasons? And then I think then take it back to to how it has helped them over the last few years. And then I think I also speak to them about what are their target goals. Are they happy to lose the physique that they have achieved in the last few years? Or is it now that they are ready to have their family and the sperm count is more important for them? And then we offer them certain tests. And of course, like you said, we don't endorse any exogenous testosterone use unless it's prescribed by a doctor. And we have also got Dr. Sobia, who's endocrinologist and specialist in hormones. So there are a few incidences where we have done some initial tests and the results were what we were hoping for, or there were some of them quite interesting high results as well. So we seek her opinion on that. So we try to get the help for our patients, not only from a general practice point of view, but also from a specialist point of view, trying to give them the best advice.
And Dr. Hassan, when you see patients in general who are trying to, have a baby or struggling with their fertility, especially in men, are there any testing that you offer them at the House of Health?
So at House of Health, we are the first clinic in West Midlands who offer at home sperm analysis kit. What that means is that you can liaise with us and then we can get the kit sent out to your home. You don't need to come and visit a clinic. You can do the sample in your comfort of your own home, and then you can post it out to the nearest post office. The results come back to us, and we also offer a GP appointment because the results are quite difficult to interpret. Not everyone can interpret. Even some general practitioners can have difficulties. So we have done some extra training in terms of interpreting those results by a urologist, and then we tell them what this actually sperm count or the sperm result mean for you, and then what can be done to if there are any problems with that.
Fantastic. And also because, you are at the House of Health and you're running all these health checks, I believe there is a health MOT that you offer. Could you tell us a little bit about, how your health MOT is different from any other clinic, right, left and center that's offering it?
So I think I really seek pride in, when I tell patients about the health MOT we offer, because there are three parts to it. The first part is the conversation with not only any healthcare practitioner, but with a general practitioner. And we, as you are a GP as well, you are aware, we are trained in looking after people from the time they're born to the time they die. So, in our health MOT, so the first part is the discussion with the GP, which includes all sort of conversation about why they wanted to come and have this test done in the first place, or what has prompted them, including, if they have got any healthcare problems, any medications they are taking. So all that is taken into consideration. And the next step is where they have a next part is, where they have an appointment with a healthcare assistant who takes their blood pressure, body fat analysis, their BMI. And then the third part is doing their blood test. And the interesting thing which I really like about our health MOT is we also offer a GP appointment as a part of our health MOT, which means if there are any problems in your blood test, so, we have taken your history before. So then we interpret those results, taking that thing into consideration. And then we offer you a tailored approach in terms of what these tests mean for you and what can be done for your health going forward.
And with your health MOTs, there are some where you can have an ECG as well.
Yes.
How important is that for gym goers?
It's extremely important because, as you know, most of the people who go to gym, they have used testosterone, either they are currently using it or they have used it in the past, and it does affect heart muscles. So it is very important, especially for those people, to have ECG as a part of the health MOT, So we can look what the heart health is, what it looks like, and whether there is something that needs to be. In fact, we had a patient who came to us for a general health check. And as part of their health MOT, we offered them ECG, and that did show that their heart has actually increased quite massively in size. And we got them the help through the cardiologist. We offered them an echo, and then the advice which we offered them was tailored according to what their needs. I will also say, it is individualized MOT, because for people above 40, we offer them certain different tests. For example, a PSA, which is usually not needed, or it doesn't cause much problem in men who are under the age of 40. Similarly, for men also, so, it's tailored to according to what their requirements are.
Yes, and Dr. Arshad, when we talk about testosterone use, I mean, it's rife. It's something that is happening right, left, center. People go on these cycles of testosterone, which they have sourced from a friend to look better. Now, you have mentioned beta HCG, and you have said that when patients have come off the testosterone and want to have a child or want to have children and commence their family and are struggling with it, there are medications that you as an endocrinologist can prescribe to help them. So tell us more about beta HCG and the role of beta HCG in this process.
So what I meant was that when patients have taken testosterone without a consult or without a diagnosis, we need to stop and we need to make a diagnosis. Testosterone is produced in testes, but under the influence of pituitary gland. So either the problem is in the pituitary gland or in the testes. So we need to find out. Depending on where the problem is, then you treat, right? I will not promote these treatment on anyone who actually does not have a problem. Yeah, if they do not have a problem, then once they have stopped testosterone, give them 3, 6, 9 months, they will restart. If they're not restarting, then you need these treatments to see if we can supplement that with the help of fertility clinics. These are quite expensive treatment. They need a lot of monitoring, and that is purely based to produce sperm so they can father a child.
Definitely not self-medicating,
Never.
not self-sourcing. So the emphasis of today's podcast really is that don't be afraid of seeking help. We certainly at the House of Health are happy to help you, but please come and speak to a doctor and seek the right advice. Now, this particular patient that Sidra mentioned, also saw Dr. Hassan, and the beauty of the consultation was that they came off the testosterone, and their testosterone levels actually went back to normal.
Yeah, I saw them.
Yes, you saw them. Yes. So it's don't be scared of coming off testosterone. Is basically, I remember Dr. Arshad. She always, this particular patient wanted me to be part of the consultation as well, and I was part of this consultation where they were really scared, didn't know what to expect, and coming off testosterone was a big fear for them. But Dr. Arshad, the way she explained it to him, it was phenomenal. It was beautiful.
I
that
love
consultation.
saying that we don't actually need testosterone to live.
Yes.
It does improve your quality of life if the levels are very low and you replace that. But testosterone is a sex hormone. We don't need it all the time. We just need it. Hormones are produced in response to our requirement. They're not high all the time. So sometimes people fall in that trap because they had testosterone checked 2 p.m. when they were at work. Of course, it's going to be low, but we shouldn't be having very high testosterone at that time because it's not required. So, testing at the right time, fasting, 9 a.m. sample, and making a right diagnosis. Because if they actually have low testosterone, you should be questioning why. Where is the problem? Especially if it's because the pituitary gland, then other hormones are more important, than testosterone. And I also give example to patients. That's people who are in a very stressful situations, like in prison or in a war or in a famine or in like a captivity. Their testosterone levels might be very, very low or have a very prolonged hospital admission. And that is the appropriate response because nature does not want you to have high testosterone at that time. And once you're out of that stressful situation, it will get normalized. So finding out the cause and treating the cause is very important. And one thing I really want to add is that don't overestimate testosterone. It's not that amazing. It's not that amazing. I'll have testosterone. I'm going to feel great. I'm going to have energy. I'm going to have muscles. No, it's not that great. It's a sex hormone, which will improve your muscle bulk. It will give you more masculine features. Yes, but that is it really. People who especially seek that for erectile dysfunction is again a very wrong concept, because you can have very good testosterone and you still may have erectile dysfunction. So we need to really see what is the symptom and treat that accordingly.
Yeah, and Dr. Sidra, in your clinic, you see a lot of patients who have erectile dysfunction with normal testosterone levels, and you also do something called psychosexual counseling, which is phenomenal, because we now know, and there's evidence to suggest that when it comes to erectile dysfunction, it doesn't necessarily have to be something pathological, which means a disease in the body causing it, but it could be psychological as well. So tell us more about the role of psychosexual counseling in anyone who is suffering from sexual dysfunction.
I think it has a key role. Even I suppose, even if there is an underlying metabolic or pathological cause, even then the psychosexual counseling does play a role in improving sexual dysfunction. Because like Dr. Sobia said, so there are a small number of people where fertility is actually affected by the hormone levels. Majority of the people, it is either a past difficult experience in terms of a sexual life, or generally in your life, if you are under a lot of stress, if your body is under a lot of stress, or if you are struggling if you are having problems with your current relationship, all these things lead to sexual dysfunction. So while testosterone replacement therapy will only cure the problems that are caused by the lack of hormones, psychosexual counseling is something that addresses all these underlying problems. And there are usually more than one session that is required. And I have seen people who have they were able to have the relationship improve. They were able to have sex again. They were able to enjoy it again, both men and women. So it definitely has a key.
Fantastic. Dr. Sobia, what is your message to anyone who is watching this podcast and eagerly waiting for some advice from a hormone specialist?
I will say two things here. First, I'm repeating that it's not that amazing. It's not a key to all problems. And as Dr. Hassan very rightly said that, 90% of that is in our brain, how we think, how we feel, if you are not in a right situation with the right person, you shouldn't be having very high levels of sex hormones, because that's not how our brain works. And the second thing I want to say is that, and I forgot, there was a very important point I actually wanted to make. I'll give you a time.
I have got a very important question to ask. Like Dr. Raja said, so some of our patients are gym goers and they have been using this testosterone for years and years. And of course, it's easy for us as doctors to say, "Oh, stop it." But I can imagine it would be a very daunting experience for them to stop using something which they have been using for so long. So there are many people who would take doctor's advice and they will be happy to come off it. But is there anything that you would advise them to try meanwhile? What I'm trying to ask is, are there any natural ways of boosting your sex hormones, particularly testosterone?
Yeah, and I remember what point I wanted to make. So now I'm going to have, again, two-part answer, a very, very good question. So because we don't need sex hormone to live, if we don't have very high testosterone for a few months, it's not too dangerous. And there are people who have low testosterone and they don't even realize that for many, many years. The reason we replace testosterone is for bone health and a muscle health, not for sexual health, right? So take that point. The second thing is, when I said we have to really find a cause for testosterone being low or less, and one of the major causes is testosterone is produced enough, but is ineffective. And what makes testosterone ineffective is the fat cells. So if you are obese and your fat cells will block your hormones. So lots of people know about insulin resistance, but they don't realize that the resistance is to all the hormones, including sex hormones, including testosterone. And I have lots of patients who came to asking testosterone replacement because they had evidence that testosterone is low. And I've told them that, yes, it is low, but it's low because the active form is not there, because it's been blocked by your obesity. And if you trust me and manage your obesity and you lose weight, whatever ways, if you can lose it organically by intermittent fasting, low carbohydrate, direct exercise, which is harder, but still a doable route, or with the help of medications, when they lose weight, testosterone levels come up. So to answer your question, it's not dangerous to stop it, because all these hormonal therapies, including growth hormone, testosterone, people who are on established replacements, when they are unwell and they're in a hospital, we tell them not to take it. Because you don't need that when you're unwell, because the body wants to survive, wants to recover from that. You don't need sex hormone at that time. So don't overestimate it and find a cause.
And like you said, if you are overweight, try to work on your weight, because that will naturally boost your
That will
natural
naturally
levels.
boost it. And if they are taking it just to feel less tired, you need to find why the body is making them tired. And majority of the time, I think, there's something else. And testosterone just takes the blame because it's a fancy thing, or quick fix. People see it as a quick fix. It's not a quick fix. And you can, I'm sure you both have experience. I'm sure you have both experienced that these gym goers with very big muscles and have taken testosterone and steroids. They are not very happy people. They're not going to come and say, "Oh, I have so much energy." Do they say they have so much energy? They're tired. They're tired because their intrinsic hormones are not being produced. Am I right?
Yeah, you are right. And another tip to raise your natural levels of testosterone also is just to sort of add to your question, Sidra, which is basic stuff which all of us should follow really, is to curtail blue light, especially in the evenings. If you are not looking at your screen 24/7 before you're going to bed, that might help your testosterone levels. So it's just little basic things that you need to do. Good diet, exercise, but don't over-exercise. That can also be counterproductive. Lack of stress, meditation, take 10 minutes out, breathe, do mindfulness. Genuinely, all of us can do this, I think. 10 minutes where you just close your eyes, take a deep breath. I don't follow this, but I wish to follow it one day. And just, look after
Anita, I have a
yourself.
question for you. You talked about testosterone replacement in men. What about women who got hypogonadotrophic hypogonadism, or women who are very slim and anorexic and they have very low estrogen levels and their periods stop? Do they go on estrogen replacement in your practice?
No. No, we just ask them to gain weight.
Yeah, we just ask
Oh,
them to gain
yeah,
weight.
yeah.
Yes,
Yeah.
yes.
So it's the same concept.
Yeah.
So when we know, and I tell patients that brain's job is to keep us alive and keep us safe. And brain is very protective of all human beings, especially mothers. So when they see that, someone is working out too much, if you're doing a lot of exercise, lifting weights, running marathons, the brain senses that maybe you're running from an enemy or from a war or from a prison, and you're stressed and said, let's not give her a baby. And how nature can stop that? By blocking your hormones. And that's the reason, both for male and women, if they're very stressed, they're working out inorganically. We were not designed to just, keep on working out in a gym and have these supplements. Then the body will stop.
So the natural way is the best way. The natural is the best way. Yeah. I hope you guys enjoyed.
Gentle exercise.
Gentle exercise. Don't overdo things, and listen to Dr. Sobyarsha. Stay tuned for another episode of the House of Health podcast. Bye.